Hello, this is Sam. I'm going to be doing my head-to-toe osce on this mannequin I've created. I'm going to kind of use the sweatshirt or the jacket as kind of the body, so I won't be taking that off just to give it some shape. Alright, so hang with me. I'm not going to do the voice for him. We'll just kind of go along with it, and I'll talk you through it as if I was doing it. Alright. Hello, this is your nurse Sam. I'm going to be doing a head-to-toe assessment. May I come in? Yeah, he says yes, so we will be entering the domicile. So I come in. First, I'm going to check, make sure everything's safe, introduce myself, get the confirmation of the name, just to make sure we got the right patient. You know, I look around, make sure the bed's locked, make sure the room has everything that we need. The first thing I want to do is kind of ask the age, and I could check the MRN and the date on it to make sure this is in fact the right patient. It would also help with some orientation. From here, I could check, kind of see if, sorry, I lost my train of thought. I could check here and see if he has any allergies using the band too. Typically they're there, ask him about it, because the band might be wrong. Make sure the bed's lowered. If there's one railing down in case he has to leave. And from here, I could kind of check the orientation. I could say, like, say, sir, do you know why you're here? And he could be like, I feel very stiff. And I could be like, okay, and where is your pain at? And he could say, I feel so stiff because I'm bored and I'm feeling it in my back. And I would say, we could do an old cart factor. See, it's going down here. I could say, what's the location of the pain? And he could be like, oh, it's my back that's really hurting. And, I could note kind of here that he feels very light for his age and his size. And we could say the location, maybe in the back. So I could say, where's the pain? He could say it's in my back. I could say what makes it worse, and he could say, like being made out of cardboard. And now I'm going to check, kind of see if he knows where he is. Do you know what the date is? Let's say he just aced it. He knew it was President's Day, February 21st. Actually, it's the 22nd now. Do you know where you are? Let's say he does. He knows that he's in my basement, so there he goes. And I'll ask, like, do you know why you're here? And he said, yeah, I feel like I'm very stiff. So we've confirmed he kind of knows where he is. Now I'm going to ask if he would like me to do it or would allow me to do a head-to-toe assessment. He says yes. So I'm going to start kind of from the top, feeling around. The head feels very regular, very patent. Now I'm going to check to see for symmetry of the head. Look on both sides, looks very symmetrical. Now I'm going to check to see if the pupils are reactive to light and they accommodate. So here's my pen light. So I flick it on, looking in here, and the pupils dilate. As we mentioned, the head is not symmetrical because I didn't draw it very well. I don't know if you can see it. So maybe I'll hold it a little closer. So I did with the perla or not with the perla, but using that, the pupils are reactive to light. And then I could do the accommodation. We could check the other eye as well. And then I'd ask the patient if he typically uses any glasses, any hearing aids. He says no, he can see just fine on his own. Then I'd kind of look down here, see if there's any jugular distension. Maybe we'll draw some. But let's say he doesn't have any. I'd also take a moment to kind of assess the mouth. With masks, we wouldn't be doing this as much, but I'd have him open up and I could kind of take a look around in there, see if there's anything funky going on. I'm going to push in on kind of there, check for capillary refill. So kind of at the head, everything's looking good. Doesn't need any hearing aids, no glasses, so we're good there. There There's good symmetry. The pupils look good. Capillary refill, no jugular distension. So now we're going to go and kind of look at the arms, or you could kind of go to the torso, but I'm going to check to see, first I'm going to kind of raise the arms up, see kind of if they're both easy to push down. They are, or they weren't, so 5 out of 5 strength on both. I'm kind of looking at the skin, making sure it looks appropriate for the age, no lesions, no edema. So I'm kind of descending down the arms. I could check the radial pulses on both. Bilateral, it's normal, not bounding, not thready, so that's +2 in both. I'd have him squeeze my hand, and he exhibited excellent strength on both, so we know that. So despite the face, maybe it was natural, maybe he was drawn like that. So we know that. Again, we check the pulse. Do you have any tingling, any numbness? He says he does not have any tingling or numbness, which is a great sign. Or I don't know, maybe it's here. So we kind of assess for the numbness. We could look at the fingernails. They look good. They're flat. They're not spooning or anything. They're pink. They're all, everything. He's maintaining this kind of skin color throughout. So we can kind of move on from our assessment there with the strength and such. So now we're going to listen to his chest. The first one I'm going to choose to do is listen to the heart. As I said, this is kind of his, we'll say that he's shirtless just to give him some good form. So the first one we're going to listen to is the aortic. Then we'll do the pulmonic. Then Erb's point. Then the tricuspid. Then the apical. It sounds great, sounds appropriate. We had the S1, S2 lub-dub sound, so that sounded normal. No murmurs, none of that. So now we're going to listen for some lung noises. I'm going to go in kind of like as if he's Superman, so like an S or 5. Alright, just breathe in, breathe out, and just keep taking big, deep breaths like that. All right, no wheezing, no sounds of edema, so no rustling, rattling. This would be more like crackling. Now I've kind of turned my guy over, and I'm going to listen to him, kind of like as if there's a strap on him. So we're going to do 4 on each side. So just keep breathing in. I'm kind of speeding this up. All right. So now, let me flip this again. I'm going to look at his stomach, and again, I'm looking for any edema, any lesions, anything kind of out of the ordinary. And the first thing we're going to do is we're going to listen to the 4 quadrants. So, just listening for bowel noises. And I'd also ask, maybe after this, but I'd ask when the last bowel movement was as we're going through these quadrants. When, if he's had any trouble voiding. And kind of ask what's normal for him. And then at this point, we could kind of palpate, feel if there's any pain. We kind of confirm that the bowel noises were normal. Kind of feeling around. From here, this would probably be a good time to do some vital signs. So we could get his blood pressure. I'd put this over the brachial artery, pump it up until we kind of occlude that, then get it to maybe 160, and then listen for that. Listen for those, the Korsakoff noises, and kind of record that. Let's say it sounded great. And then also I'd have my watch here looking at it, and I do the first 30 seconds counting that pulse, and then I trick him for the rest of the minute and count respirations. I think in my initial video, this was something I did pretty well, passed it off, so maybe we won't do the full 30 seconds, but the point is I wouldn't let him know that I was counting my respirations, because it can change the way kind of people breathe. But anyways, let's say his was 14, so it sounded great, or it looked great. Let's say he had 72 pulse or something. Let's say the blood pressure was like 110/70. So no concerns there. We were feeling around. Everything felt good. I put the pulse oximeter on him, grabbed his temperature. I got a forehead one. Check the oxygen, 97. Great, especially at this altitude. So everything's looking good there. Everything was normal. Take this off. And now I'm going to kind of go down into the feet. So on the feet, we're still looking for any lesions, any edema. I'm checking for capillary refill. We checked that on the hand. I don't remember if I said that. But I'm definitely also checking it on the feet, looking for any swelling. And he's got some odd toes, as you can see. Kind of looking for anything different, especially, if there's a history of diabetes or anything. Kind of looking for any abrasions. And we could listen to the pedal pulse, kind of by the second toe feeling back, or we could listen to the dorsal one, kind of on the back side, kind of right here. If this was a hospital environment, I'd be wearing shoes, but this is my place, so I'm not. And I'm going to ask if any numbness or tingling, and then I'm going to kind of pretend like it's a gas pedal and push down, and then kind of push up, and we'll see kind of if there's how the strength is. I believe maybe also if you were doing some stuff, you could check for clotus there. Anyways, so numbness, tingling, strength, see if it's equal, any deficits. We could check for capillary refill, so super sturdy. And then the pulse we'll say was +2 on both, so normal. No bounding, it's not thready. The strength was +5 in both, well-nourished guy. So kind of from a physical perspective, we've looked at everything. So now it would be important to kind of talk to him about the psychosocial aspects. So I'd be talking to him, asking him if how he's coping with this, where he lives. So kind of the first thing you'd say is, how do you feel like you're coping with this? 1 to 10, just like we would have at the start. I almost forgot this, but we'd ask with the pain scale. Or one second, I'll get to it. Anyways, we talked to him kind of about the psychosocial aspects. So we say 1 to 10, how are you coping with this? How do you feel like you have your ability to cope with this? Then we could ask kind of who he's living with, kind of what's home life like, what's the work life like, but we kind of structure it as in like kind of who's there that you can kind of rely on, who are your like caretakers maybe. If you have a spouse, do you live with your kids? Maybe what do you do for work? And then we kind of proceed on to asking him kind of like what maybe his goals are for the day. So maybe like, does he want to get up? And this is something I kind of forgot earlier on, but the scale reminded me. We'd want to ask him at the start kind of 1 to 10 pain scale, how he's feeling about that. So kind of ask him like 0 being no pain, 10 being the most extreme pain ever. Kind of what he's feeling, maybe kind of what would be a more manageable level. But we would want to do that probably after the allergy, kind of before the old carb factors. So from here, essentially, we're done with the basic head-to-toe assessment. Kind of talk to him about some things. Now we want to make sure the area is safe, make sure the bed's lowered, make sure the room is everything in case the worst happens, make sure there's nothing on the floor, make sure one bed railing's down, and we are good to go. All right, thank you. All right, bye, sir, and then hand hygiene, and we're out.